Hi, my name is Dr. John Heary, and today we're going to be talking about hormones. More specifically, we're going to be talking about menopause and hormone replacement therapy. There's a time when menopause was just a natural female bodily function, and literally, when you break down that word, menopause means the last menstrual period. The change of life, or perimenopause, is the entire transitional period of time from the first signs of change until after menses have completely been gone for a year. Nowadays, the medical establishment views menopause as a hormone deficiency disease. Hormone replacement therapy is the routine treatment for menopausal women. Even healthy women, regardless of the well-documented risks associated with these drugs. Hormones, they're without a doubt some of the most potent, health altering compounds in existence. When the hormones, are not, naturally produced by the body, there can be serious, adverse side effects. HRT works by suppressing symptoms, but since the biochemistry is so complex, intricate, and interactive, the routine use of hormone drugs, it's like playing with fire. Once upon a time, hormones, were offered to women for just a short period of time to alleviate, menopausal symptoms such as, hot flashes, depression, mood swings. If they're having trouble handling sweat, stress, vaginal dryness. Today, estrogen in combination with progesterone for women with an intact uterus is advised for long periods of time, or lifelong, to prevent osteoporosis and heart disease and chronic degenerative diseases. Many researchers feel this is the wrong way to approach such problems. Using drugs, of unknown safety and effectiveness on an entire population in an attempt to prevent chronic disease conditions doesn't make sense when lifestyle changes or other therapies, including nutrition, may be more than adequate to prevent, slow, and even reverse these conditions for many women. In other words, there's other options for relieving menopausal symptoms and for offsetting osteoporosis, heart disease, and other health issues or health problems. Viewing menopause as a hormone deficiency for which replacement is needed, it's the same as viewing depression, as a deficiency of Prozac, or heartburn, as a deficiency of Tums. Replacement implies women are supposed to have higher estrogen levels after menopause. This just isn't true. During childbearing years, a woman's body naturally produces two main groups of female hormones. You have your estrogen and you have your progesterone. When in her mid to upper 40s or early 50s, a woman's ovaries gradually and naturally produce less hormones, so that the monthly menstrual period at first, may become erratic, skipping it, or you have, two in a month, etc., and then ceases altogether. During perimenopause, the ratio of estrogen to progesterone, it may fluctuate in some women, sort of a puberty in reverse, causing a number of possible symptoms such as, hot flashes, vaginal dryness, thinning, of your urinary tract inflammation, irritability, depression, anxiety. Sometimes you might get some excessive menstrual flow. In some women, they'll just stop menstruating. Menopause, doesn't mean ovarian failure. The ovaries continue to produce estrogen and other hormones at lower levels, at least until the woman's in her 80s or even longer. So the ovaries, they don't just stop functioning, they just stop producing eggs. A healthy woman with functioning ovaries doesn't dry up like an old prune. It doesn't lose femininity, or attractiveness, is not condemned to chronic degenerative diseases. True hormonal health depends on having all the essential nutrients your body needs to produce the right hormones and to metabolize them properly. For example, the liver requires the vitamin B complex to break down estrogens and convert them into the safe, form usable by the body. Nutritional precursors, cholesterol, vitamins A, C, and E complexes, essential fatty acids, chlorophyll, total proteins, minerals, trace mineral cofactors, etc. They're needed for synthesis and balance of hormones. Recent studies have uncovered a multitude of phytoestrogens or compounds in plants which support hormonal balance when ingested from whole, natural, unaltered foods. Altering a health depleting lifestyle into a health promoting pattern can always reap benefits. It's never too late to start creating hormonal health and balance. Um, Estrogen therapy or drug therapy relieves hot flashes, vaginal dryness, and mood swings in most women. Alternatively, nutritional support to the endocrine gland system, especially the ovaries, the adrenals, the thyroid, and a hormonal balance, often lessens or alleviates these symptoms. Adjunctive support to the nervous system further aids their emotional or mental aspects. Dietary changes can bring dramatic improvements. Avoiding refined, processed, altered, additive-laden non-foods and follow nutrition while emphasizing fresh, whole natural foods, including plenty of vegetables and fruits, is recommended. An unrefined oil, wheat germ, almond or coconut, for instance, applied directly to the vagina may also relieve vaginal dryness and itching. Kegel exercises can help strengthen the muscles surrounding the bladder and vagina, along with nutritive assistance, can improve urinary control and orgasmic response. Women, women who've had their ovaries surgically removed, or those who experience severe menopausal symptoms because of the abrupt withdrawal of hormone drugs, may not be able to be managed by natural remedies alone, though it has been done. So hormone medication may be a necessity. Contributing to, the recent increase in, hormonal disruptions are, chemical and hormone poisons and pollutants. By 1996, researchers, they identified at least 51 synthetic chemicals, and many of them pervasive in the environment, such as pesticides, that disrupt the endocrine system. These hormone disruptors, including large chemical families such as 209 PCB compounds, there's 75 dioxins, 135 furans. Some mimic estrogen, like DES, diethylstilbestrol. Those toxic compounds, they can cause dysfunction in the gonads. They threaten embryonic survival. They can increase the risk of breast cancer, urogenital cancers, thyroid dysfunction, autoimmune thyroids, developmental defects in many tissues. The list of hormone disrupting agents, it continues to grow. These human made hormone mimics, in different ways, and fundamental from plant hormones, but the body can break down and excrete the natural plant compounds and can evidently use some of them to balance and benefit glandular health. There's still, we still need to learn more about it, but for example, Orientals ascertained years ago that soy is best handled as food only when it's fermented. Soy products, unfermented or improperly fermented and mass produced, are being promoted for their phytoestrogens with possible discomforting effects. Synthetic hormone mimics are toxic poisons and can persist in the body. They may be ingested, breathed in from the air, or absorbed through the skin. Some are estrogenic, artificially imitating the effects of estrogen, whereas others are anti-estrogenic, blocking or interfering with the use of estrogen. Hormone drugs can be, consumed in animal foods. For example, growth hormones are injected into meat animals. Another is the bovine growth hormone, somatotropin, which can be given to cows to boost milk production, which can have effects when milk or milk products are consumed. Any hormones, even at minute amounts, can have disruptive influence. So we'll talk more about estrogen and progesterone. Estrogen, it's a group of 20 related hormones, the most predominant being estrone, estradiol, and their metabolic product estriol. Progesterone is the other principal female steroid hormone. Healthy, well-nourished ovarian follicle cells produce a healthy balance of estrogen and progesterone. Dysfunction of the ovary follicle cell from any cause such as toxic insults or nutritional deficiencies can result in hormonal imbalances, bringing on a whole wide array of symptoms that are often seen in perimenopausal and menopausal women. Hormone replacement therapy, consists of hormone drugs, primarily estrogen. Now, taken by itself, estrogen causes a buildup of the endometrium, the uterine lining, substantially increasing by over 4 times the risk of endometrial cancer. Adding progestin, which is a synthetic progesterone for a woman who has her uterus, prompts the sewing off of the endometrium periodically, just like menstruation, and that reduces but doesn't completely eliminate the risk. If progesterone is taken, fewer than 10 days a month, the risk of endometrial cancer increases 3 times. If it's taken 10 to 21 days a month, the risk is increased only slightly. But continuing estrogen and progesterone more than 5 years increases the cancer risk 2.5 times. Most hormone drugs on the market today, they're manufactured from natural raw materials found in horse urine, soybeans, or yams. So first of all, they're certainly not the hormones produced by a woman's body. And second, they're put through, many chemical alterations in the lab so that they don't resemble the original source. And third, instead of, imitating the structure of the female hormones, drug companies usually change the original structure so a patentable product is made. True natural hormones are considered generic and can't be patented under most circumstances. The estrogen patch, such as estroderm or Samara, it contains a hormone with similar structure, to a human hormone, but so the manufacturers they can patent it, and that's where big pharma comes in is when you start putting patents on these meds. The biochemical manipulation and pharmaceutical substitution for an extremely powerful chemical messenger, it goes far beyond our current understanding of possible ill effects from taking a steroid structure that is foreign to our body. Dr. Love, she feels that the benefits have been overestimated and risks have been underestimated. There's mounting evidence indicating that HRT increases the risk of breast cancer as well as many other problems. So, here we are. We don't have all the facts yet. The number one, selling drug in the HRT market was Premarin, which is, conjugated oral estrogen derived from the urine of pregnant mares. And this is going back a little bit, but 96, there's $860 million in sales. Now, the metabolic breakdown products of Premarin, are stronger than the horse estrogens. So, estrogens, they're produced in the human are metabolized into weaker compounds, but with Premarin, hormones get stronger with increased potential for harm. So, we really don't know the effects of this, especially over a long period of time. Premarin and similar compounds, are actually they're very unnatural hormones. Prempro is Premarin with a synthetic progestin, right? Provera is added to it. Estratab is a mixture of estrogenic substances, including horse estrogens. Menest is much like Premarin. Other estrogen drugs include estrogen sulfate and estradiol valerate. So though women they make different amounts of estrogen and process it differently, the drugs are often prescribed at the same one size fits all dosage. There's only one progesterone, the hormone molecule made by the ovary. Progestins used in hormone drugs are synthetic compounds. Illustrating the difference, progesterone is required for survival and development of the embryo and fetus throughout pregnancy. Provera, the most commonly prescribed progestin, increases the risk of early abortion or congenital deformities of the fetus. Provera also increases the risk of coronary artery spasm and much more. There's many contrasts between natural progesterone and the prescribed synthetic progestins. So, although HRT, decreases or eliminates, some symptoms experienced at menopause by some women, it's not a cure. Since symptoms reappear if the drugs are stopped, HRT is prescribed to prevent osteoporosis and heart disease. But the jury's still out on hormone replacement therapy's protective benefits, against these diseases. Um, I'm going to make a second video, and we're going to talk about some of the conditions, or some of the diseases that are often used, in which they use HRT, to help with those conditions, and we'll talk more about that in the next video. Okay, well, I will talk to you guys later in good health. Until next time. Okay, bye, guys.